Hi there, Andrew Merritt again. So now we're going to talk about what happens after surgery. So we've had the ACL, we've talked about the graft, we did the surgery, everything went great. But this is a critical part, not just the understanding, but what you actually do in the recovery. So part of the reason, of making these videos is because the more knowledge you have, the more empowered you are through this whole process. And this is where your hard work comes in, but also the understanding of what's going on inside your body, because how the graft heals impacts how we do recovery, how you're feeling, and ultimately lower the risk of re-injury or injury to the other ACL, which we'll talk about is a big risk as well. So talking about the rehabilitation, and then a little bit the humbling results of having this injury, especially at a young age. As much as we'd like, we're not a time machine that just transports us back to the day before you had an injury. The knee has memory. It knows it went through this injury. Even though the ACL is reconstructed, other parts of the knee have some scar tissue from the injury, from surgery. The quads are still waking back up. A lot of this impacts how you're doing afterwards. And the key, or at least it starts with the knowledge of what's going on. So let's talk about that. So we talked about the ACL here. We've drilled the tunnel up into the knee on both sides. We brought the graft across. We get essentially, if we got an MRI to look like we're crossing the graft across, this knee now looks like we did the time machine and took it back to the day before the injury, but it's just not the case, and we'll talk about that. Looking at that MRI, we're crossing the graft. Everything looks good. This again is what the x-ray looks like. We have the tunnel up on the femur, the tunnel on the tibia, the bone graft. This was a patellar tendon graft in this example. The graft is crossing between these, okay? So this is the important concept that we talked about initially. So there's a few stages. First, we have to heal into the tunnel. So in this case, bone, but some cases, soft tissue has to heal into these tunnels. These little pieces of metal are holding it temporarily at a very good tension to hold that ACL in place. But ultimately, they're only there for so long, because what ends up having to happen is that you heal into the tunnel, whether it be the soft tissue or the bone. Then the graft needs to start to heal. The actual graft fibers, they need blood supply. Our body is in a constant state of breakdown and build back up. When we go to the gym and we work out, we're sore the next day. We tore little bits of that muscle, and then blood comes in, repairs that muscle, and makes you a little bit stronger. The same thing happens with our skin, our ligaments, muscles, bone. Everything's in a constant state of breakdown and build back up. But to do that, you need blood supply. That's part of this graft healing. And then eventually maturation. Maturation means reorientation of the collagen fibers, getting the collagen to grow over the scaffold of the graft and turn this into essentially the normal geometry of a functioning ACL. That process takes a while. That's why this recovery is a long time. We don't make this a recovery prolonged just because we want to be mean or anything like that. That's how long this takes. And we'll go over that. So if we look at the timeline of the graft recovery, so this is not your recovery, but it's important to know the graft recovery because it educates us on why we're letting you do certain steps through the recovery. So the first 3 months, really the protective phase. What's happening is the tunnels are healing, and it's the start of vascularization. Start getting blood supply into that graft. But the graft actually weakens during this period, because your body starts to eat it away, and that's part of the process of it getting blood flow back up and using it essentially as a scaffold to build your new collagen tissue across the knee joint. So the first 3 months, the graft actually weakens before it gets stronger, and so that's important when we start talking about the recovery. 3 to 6 months, the graft's now remodeling, still weak during that time period. That's why we don't want you doing cutting and pivoting activities, something that strains that ACL. 6 to 9 months, now the collagen, it's got blood supply, it's starting to reorient, the collagen's growing, it's starting to look more like a normal ACL instead of the graft that we put in. The collagen alignment is a big thing there. The way that the knee moves has to have certain collagen fibers strong in flexion and certain ones in extension, and your body is starting to figure this out. Full maturation, really it's about this 24-month time period. We generally, if someone's doing well, we let them go back to sports at 9 months. That's usually when the quad control is good, the muscle control of the knee is good. You're able to protect yourself. You've learned the mechanics to not land with valgus knees and how to protect the knee as best as possible. And the graft is probably strong enough to tolerate those type of activities. But 9 months is where that starts, and it continues to mature for that full 24 months to get full revascularization. That's the blood flow, final alignment, and strength. And that's why the recovery, what you do with physical therapy, what I allow you to do, tracks along with this. And so understanding that helps you not get frustrated that we're not allowing you to do more with PT. So the first 3 months, we want knee motion, quad function, getting that quad firing. Anything where the knee's just moving up and down, forward activities, those things are fine. That's not stressing the ACL. 3 to 6 months, we still are in the protective phase of the recovery because the ACL is still at weaker than when we put it in and far weaker than it will eventually be. You can increase non-straining ACL activities like running, those kind of activities, really working on body mechanics. Great form when you're doing squats, great form when you're running in and not letting that knee buckle inwards. Really being strict on body mechanics. 6 to 9 months, we can start doing sport-specific drills under a controlled environment, start doing controlled pivoting. Again, you controlling yourself doing side-to-side twisting activities is much less or much different than, say, defending someone in basketball where you don't know which way they're about to go, and essentially your body can get over your knee and get into that buckling position. So we start to allow those activities, but in a controlled environment. Full return to sports, 9 to 24 months. 9 months is my recommendation as long as you're doing well. That's the earliest. As long as you're doing well, sometimes we'll push that to 8 months in certain circumstances, but really there's even a push to push this out longer. So there's surgeons out there that are advertising that their patients can get back faster. Their patients, only need 6 months till sports. Absolutely. There's lots of patients that can go and play their sport activity at 6 months. Absolutely. Their quads are firing well. Their motion looks good, all of that sort of stuff. My argument is that the graft is not ready, and that's backed up pretty good by science. In fact, all the way up to 24 months, such that there's actually studies on this. So this part of the talks is going to get a little bit into the research, but I just want you to know why we make these decisions. So this was a study of athletes, young athletes who returned to sport before 9 months. So surgeons advertising this, we can get you back before 9 months. Absolutely. They have an injury rate 7 times those who delay it past 9 months. Okay. Now, it's not worth going back at 6 months to get that extra 3 months if you're going to have a 7 times higher rate of re-injury subsequently. Now, what a lot of people say is they went back at 6 months and they get to a year and a half. They're now a year out from returning to sports and they're still doing great. The thought would be, I have successfully taken on that risk and it has not retorn. Boom, I made it. It was worth it. Unfortunately, that's not the truth. If you look at this graft here, yellow is people that waited the full 9 months, and you see around this 24-month mark, this 2-year mark, their rate of re-tear stays the same. And what happens to those that went early? They jump up significantly, okay? And the reason why is the graft is strong. The graft will hold you for quite some time. But if we stop or kind of allow sports such that we interrupt the healing process, that full revascularization, the collagen reorientation, all of those things, we may not see the ACL tear for another year, year and a half, because the graft is strong. Even though it's a dead graft, it didn't become alive, it didn't go through the maturation process, it's still a big chunk of collagen that's going to hold your knee there for a while until it doesn't. And so what we see is they went back here, not that many, a few little re-tears, but it was all afterwards because we never let that graft get through the maturation process. And so I'm a big proponent of trying to wait. In fact, there are some people that are arguing we should wait 2 years. And I agree in some specific circumstances, usually 9 months. 9 months is my rule. But if you have poor body mechanics, you don't rehab it well, you got really high anatomic risk factors, really high demand sports, or return to sports is not your main goal. Say you play a little pickleball, you want to maybe play some soccer with the kids, but really you need to work, do your job. You have bigger things going on in life than returning to sports. Don't do it at 9 months then. Wait a year and a half, wait 18 months. So you're still working out in the gym, you're still lifting, you're still doing everything but high speed cutting and pivoting sports. It's not like you're sitting on the couch waiting for this to heal. You're getting stronger, you're working out. All the while, the graft is maturing behind the scenes. So if it's not critical to get back, delaying that till you get back to that cutting and pivoting sports is often beneficial. So what about when all this goes well? Let's look at the pro sports. So they have the access to the best rehab. They're generally young, fit athletes. They got good muscle control, good everything going on around them. Well, even the average return to sports was 12 months. So they're all generally cleared at 9 months. 12 months is the average time that they're fully back to sports. So even in professional athletes, it's common that that it's not at that 9 month time. And then this is where we start to get a little bit humbled that this injury and then surgery and reconstruction and rehab is still not all like a time machine that takes us back to a normal knee. So in the NFL, 55% returned to the NFL. Only 28.5 were still playing 3 years later. Now, naturally in the NFL, if you take a full year off, some people aren't going to get back to the highest level of sports. 3 years later, that's already a decent career length for an NFL athlete. So all of this has to be taken into context, but position matters. So QB and offensive line did well. They had often very long careers afterwards. Running backs, defensive backs, linebackers, receivers did not do as well. Makes kind of sense. They're the ones that are doing the cutting and pivoting, responding to someone in how they're moving so that it's an unpredictable motions and activities. They didn't do as well, both in getting back as well as their longevity of their career. And this level of return to sport is shown in lots of studies. So another study, 59% return to the pre-injury level. Another study, 83% return to pivoting sports, but only 53% to the same level. So even with good rehab, this is still an injury that impacts your life, and it's important to know that. Re-tear is one of the things that we're really trying to avoid. And interestingly, the most common, if someone comes back and they've had a right knee ACL tear and reconstruction, and they come in for another ACL injury, it's actually more common that it's on the left side, so the other side, than the one that was reconstructed. Partially, it's just they're still anatomically, people that tear their ACL, as I say, people that tear ACLs, which means their anatomy is such that they're at risk. And so their right knee was at risk, it tore first, their left knee was at risk, and then it tore subsequently. So athletes under 25 years of age, they have a 23% chance of a second ACL tear in their career. That's 30 to 40 times greater than their teammates that have never had an ACL. So once you tear an ACL, you are more likely to tear the other ACL. Not necessarily because you tore the first, but it just means that you were the type that tore an ACL and you have another knee, and that one can tear. This study showed equal between the two sides. Other studies have demonstrated more what I said before about higher on the other knee than on the reconstructed knee. But again, about a 30% tear rate at 2 years. Again, in this study, the bottom study, mostly on the contralateral side. So again, that shows why PT, they should be focusing on both sides, focusing on your mechanics, not just getting the one knee strengthened back up in good range of motion, but focusing on the entire picture, because most ACL tears are on the other side. So the long term, what does this all look like? So the good of ACL reconstruction. So superior function and stability compared to non-op. So we can't compare it to a knee that's never been injured. That doesn't make sense. That's not what we can do. We have to compare when an ACL tear happens, what is the comparison between treating it non-operatively versus surgically? Well, surgically is superior. Less risks of meniscus and cartilage damage in the future, obviously better stability, a higher return to sports compared to non-operative treatment. So once you have an ACL tear, getting it reconstructed increases the chance that you're doing all of the good stuff in life, having fun, having a stable knee, and lower the risk of the other things like cartilage and meniscus tears. But the reality is 40% of people are not getting back to the pre-injury level of sports, 20% re-tear of the graft, and tear of the contralateral side. And because of some of the injuries in the knee, arthritis, and sometimes once you have an ACL tear, a much higher risk of needing a knee replacement on that side in the future compared to your other side if it never gets torn or if you had never torn that ACL to begin with. Part of that reason of the arthritis is because when the knee shifts, you impact that cartilage, and cartilage has a long memory. It does not like impact. So we've seen these images in the other talks, but if you bruise this bone as bad as this one on the left, probably not a super high risk of this cartilage dying, but or having problems in the future and eventually getting to arthritis. But some definitely still, compared to not having had this happen. But it's patients like this that are worrisome. Big dent. You can actually see already knocked off. The cartilage is this gray, and there's already a knockoff of that cartilage in the back. As this slid out the back, it skinned off some of that cartilage. These are the people that tend to get arthritis on the outer side of their knee in the long run. 15 years, 20 years down the road. And that looks like this. You can see this person has hardware from this is how ACLs used to be fixed or secured. Now we have those little buttons that you've seen. Here's the graft tunnels. And what you can see is the inner side of the knee still has that good cartilage and completely bone on this outer side of the knee joint. So that's what arthritis commonly looks like in someone that's had a bad impaction injury after an ACL tear. So in summary, this top point is the most important. Avoid getting an ACL tear. There are, I'll probably make a video about this at some point, injury prevention strategies out there that are actually pretty effective. How you warm up, how you control your mechanics in warm up translates to how you have those mechanics in the game that you're playing. And there'll always be a random chance that you tear your ACL, absolutely. But having good core and hip strength, getting your hamstring strong, learning mechanics, and avoiding an ACL tear is the absolute best thing that you can do, okay? Period. Better than anything that we can do surgically. After the injury, educate yourself. This is why I'm doing this. I have these talks all the time in clinic, whether you're seeing me or hopefully people all over can see these videos and learn more about their injury and their problem, because this is your body, this is your injury, this is your responsibility. We will do our part, therapy will do their part, but this is your body. We have to, as surgeons, identify and treat the additional risk factors, what type of reconstruction, and frankly, a surgeon that does a lot of these gets those tunnels in the right position. They have a big role in this as well, and that does matter. The appropriate and graduated rehab protocol. So a lot of people are thinking, the more I do earlier, the better. That's a common thing that I hear. Their PT's not pushing me enough. Yeah, PT's not supposed to be pushing you actually right now. We want this graft to heal. So knowing about this is why I'm spending the time to do this. Focus on both sides and the whole body for your mechanics. Prevent the ACL tear on the other side. Get your mechanics better and allow the graft to heal. So do not get bought into this 6 months or earlier return. If you're not feeling ready, give it more time. 9 months minimum, in my opinion, or longer. And that gives you at least the best opportunity. We can't take you back in the time machine. We can't reverse that this happened, but good rehab, good surgery, motivated, educated patient, supportive family, all of these things help to get us the best outcome possible. So that's the conclusion of the rehab and general results. And as always, let me know if I can be of any help. Thanks for watching.